Well, earlier, Prime Minister Boris Johnson answered questions in the first PMQs of 2022. There are some 15 NHS hospital trusts declaring incidences amid growing staff pressure. The Labour leader, certainly not yet at least, the Labour Deputy Leader, Angela Rayner, stepped in for Sir Keir Starmer, who has COVID. Well, let's turn to the Shadow Minister for Public Health and Patient Safety, Andrew Gwynne, who joins us now. Andrew, we didn't get to see whether you perhaps cracked a smile when I made that mistake there. No. There you go, belatedly. Can I just focus on those latest figures in? We're going to try and make them a feature of our a punctuation mark in our daily story of telling the story about COVID. Hospitalizations I want to focus on. This is literally within the last half hour from the NHS. January 4th, 17,276 hospitalisations. Sounds bad. Week on week, that's up 58%. However, when you compare that to the dark days of January 2021 last year, 39,254 there. So in terms of hospitalisations, people sufficiently ill with Omicron to require hospital treatment, we're not nearly half as bad as we were almost this time last year.
No, but we're almost at the point that we were at in the first wave of coronavirus. And look, this isn't comparing things equally. The fact is that the NHS is under pressure, and we've got all a responsibility not to pile extra pressure onto the National Health Service at a time where, historically anyway, winter pressures are prevalent and impact on the delivery of care. So it's absolutely right that we proceed with a cautious approach, that we continue to roll out the booster programme, but also that we try and convince those people who haven't yet had any vaccination that it really is not just in their interest, but in the interest of the whole country, that more people get that vaccination, protect themselves and their loved ones from coronavirus, but more importantly, that we don't put unnecessary pressure on the NHS.
Andrew, would Labour consider anything, not approaching mandatory sanctions, but we're going to do an item later on this hour looking at the French President Emmanuel Macron, who has said today, and I won't repeat the language he used, it was pretty rude that he used to describe people who refused to be vaccinated. There's talk of restrictions on travel between cities, restrictions on people going to cultural events in France. France isn't alone. We've had similar language in Germany, obviously in Austria, where it's illegal not to be vaccinated. You're keen to see more people take up the jab. What would you do really to encourage them?
Well, I think what we do is we try and convince them as best we can. We try and break down some of the myths that are out there about the vaccine. The reality is, and we see it in the data, the vaccine is a bit of a game changer in that not just do we see fewer hospitalizations, we do see fewer deaths. And of those hospitalizations, we know that a great proportion of them are people who have not had a vaccine or certainly not had the booster. So we know that the booster certainly helps with the pressures in the healthcare system. It's essential as many people as possible to take up that provision while they can.
Andrew Gwynne, you say the NHS is under pressure. Undeniably true. Partly that's because of hospitalisations. It feels actually, in talking to NHS workers, the bigger problem, and they find this hugely frustrating, is that they've got to be self-isolating for 7 days. What do you say to those people who say, actually, part of the solution to this problem, this staffing problem, is to reduce that period of self-isolation, which was 10, it's now 7, and even the Scots are doing that, Nicola Sturgeon announcing that today, take it all the way down to 5, as they've done in America?
Well, hold on. I think we need to be a bit cautious here, Colin. I mean, firstly, it is still 10 days. Unless you have a negative lateral flow test on day 6 and day 7, then it can be cut to 7 days. I would want to be very cautious in terms of healthcare workers, because if they still have the coronavirus, we don't want them going back into a hospital setting and spreading that coronavirus throughout the wards and to other staff and patients. So we've got to be very cautious. But if there is an opportunity to free up staff, excuse me, who are able to return to work without coronavirus, then that should be looked at, absolutely. But we do have to be cautious here because we are talking about healthcare settings. An apology for the frog in the throat.
Well, as long as that's all it is. Andrew Gwynne, thanks very much indeed. Appreciate your time and thanks for coming on.
Thank you.